Good afternoon, everybody. Just kind of giving it a minute here while we file in from the waiting room. I'd like to welcome you to the final session of CERAH's Fall Lunch and Learn series. Thank you very much for joining us. I'm Stephanie Hendrickson. I'm a knowledge broker with CERAH, and we're pleased to have a lot of interest in today's session presented by Judy Harvey around her fellowship experience. So I just had a couple of quick housekeeping items to mention before we turn it over to Judy. The session today is being recorded and we will post it up on CERAH's YouTube channel once it's available. And we can post a link in the chat box closer to the end of the session today. If anyone would like a copy of Judy's slides, you can always send me an email and I'm happy to follow up with you and provide that. If anyone does have any technical issues or questions throughout the session, you can ask Carol Bold. You can send her a private chat message and she'll do her best to assist you if you have any technical problems. And also just to mention that Judy would like to take questions at the end of her presentation. So we do hope to have quite a bit of time allotted for that at the end. And it would be great if people are willing to unmute themselves and ask your live questions. Otherwise, you can always pop them into the chat box. So Judy has a lot to share with us today, so I'm going to introduce her without any further delay. So for those of you who don't know Judy, Judy Harvey is a registered nurse of 28 years. Currently, she is the hospice bed coordinator and the quality and safety specialist at the Nipigon District Memorial Hospital. She has worked in a number of places such as Thunder Bay, Steinbeck, Winnipeg, Manitoba, Halifax, Nova Scotia, and she currently resides in Nipigon. And Judy completed an advanced clinical practice fellowship supported by the Nipigon District Memorial Hospital and the Registered Nurses Association of Ontario. Her current research is driven by her passion for end-of-life care and the traditional Indigenous cultures of Northwestern Ontario. Judy has been published in the Hospice Palliative Care Ontario newsletter. Her article describes how to implement a hospice bed program in a rural district hospital. Judy also spoke at the Canadian National Hospice Palliative Care Association Conference in Ottawa, as well as the Hospice Palliative Care Ontario Conference in Toronto. Judy's knowledge in hospice palliative care has resulted in 100% satisfaction from the Nipigon District Memorial Hospital staffs, physicians, patients, and families. And Judy continues to pursue quality care at the bedside as she has developed a last days order set specific to Indigenous cultural practices and medicines, which will provide comfort to patients in their last days. And Judy has also developed a strategic plan, which will encompass the Indigenous values and culture at Nipigon District Memorial Hospital. So I thank you very much for joining us today, Judy, and I'm going to turn it over to you.
Thank you so much. Can everyone hear me? I want to say thank you so much for joining me today. The first thing I would like to do before we get started, I would like to respectfully acknowledge that Nipigon District Memorial Hospital is located on the traditional lands of Indigenous peoples. I am grateful to live and work in the traditional territory of the Indigenous peoples in the Robinson Superior Treaty area. Next slide, please. So here we are today. We're going to learn about advancing patient and family-centered care during end of life for the Indigenous persons and their families at Nipigon District Memorial Hospital. Next slide, please. Welcome to the presentation. Here in this picture is an event that occurred September 30th of this year at NDMH, where we joined together for a day of truth and reconciliation with our Indigenous neighbors. Next slide, please. So we'll just do a little bit of housekeeping for now. I will talk a little bit about definitions and what things mean. RNAO is the Registered Nurses Association of Ontario. AMS is the Associated Medical Services. ACPF is Advanced Clinical Practice Fellowship. The AMS and RNAO Fellowship is designed to be self-directed, intensive learning experience aimed at developing and promoting nursing knowledge and expertise and improving patient care and health outcomes in Ontario. Next slide, please. The proposed project must meet a need or address a gap in service at the sponsor organization and provide opportunity for the applicant to concretely meet his or her learning objectives through the application of range of learning activities. Next slide. So why did I choose this stream to study? In my nursing practice at Nipigon Hospital, I recognized a gap in practice regarding the end-of-life journey for Indigenous patients and their families. 33% of our patients we serve at Nipigon Hospital are Indigenous. So therefore, I asked myself this question: why is NDMH not offering specialized service for the Indigenous patients at our hospital? The fellowship document is, I will offer this document to you if you're interested. I believe, Stephanie, perhaps you can send it to our viewers if they're interested in reading further. The structure of the document has acknowledgments, introduction, chapters 1 through 9, appendices, and a reference and references. Also to let you know that I thought this was going to be an academic study, but really what happened was the formation of the structure of this document turned into really my reflection in regards to my journey. Next slide, please. Here we have the Acting International Director, Heather McConnell from RNAO. Next slide, please. RNAO Acting International Director Heather McConnell and the Regional Long-Term Care Practice Coordinator Heather Woodback. Credit is due, and this is where I'm taking the time to say thank you. I would like to take a special opportunity now to thank Nipigon District Memorial Hospital CEO Kathy Cavino, as well as nurse managers Lynn Emoff and Madison Boudreau. My mentor was Lori Croker, and my fellowship team was Kyle Lemieux, Stephen Hunt, and Jennifer Hart. Next slide, please. To continue on, I would like to take this time to also say a special, very special thank you to the elders from Pace Plat, Rocky Bay, Lake Helen, and Sioux Lookout. I'd like to thank Michael Robinson, the Indigenous Spiritual Support at the Thunder Bay Regional Health Science Center, Kathy Loon, the Indigenous Resource Manager at the Manuin Health Center, Paul Morley, my producer and director, who created the video that we are going to see today, Carter Demonsky for the formatting of my fellowship, Nancy Gladden she did the editing of the fellowship document. She is a Nipigon Hospital board member. And of course, my husband, Richard Harvey, Mayor of Nipigon, who was an integral part of my journey in the fact that he really did hold me up and support me during venturing into the very dark history of our nation. Next slide, please. So here we have, I had a wonderful opportunity to get together with four of the First Nation elders from Pace Plat. A friend of mine took me aside before I went to Pace Plat, and she stated, Judy, this is very important for you to know, that within our Indigenous culture, it's very important to be silent. And being my friend, she knows that I do have the gift of gab, and I could talk for a long period of time. So she said, it's very important for you to be silent. So this is indeed what I had to do in order to listen to their stories. We are going to hear from the elders shortly in a video that we created. I hope you can draw from their own journey when they had their friends and family that was experiencing an end-of-life journey and what that meant to them and how it affected them. Next slide, please. This is Simone. Simone is from Rocky Bay, which is a 45-minute drive north of Nipigon. I have known Simone for many years via interactions at the hospital and in our community. One day, Simone was visiting the hospital. I asked her if I could just ask her a few questions in regards to the traditions that take place in her community and what happens when a person is dying and what happens when the person has died. How does the community participate in those traditions? The moment was right to ask the few questions. What Simone shared with me was everyone is different, and it is important to ask the question, what is meaningful to you in your last days? Next slide, please. This is Michael Robinson. I spent a day with Michael. Michael walked me through the practical aspects of the First Nation culture and practices. One of the things he shared with me that day was his experience when he traveled the circle route of Lake Superior. During this journey, he experienced over 150 different Indigenous traditions. This demonstrates that everyone is different. Therefore, it's important to ask the question, what is meaningful to you in your last days? Next slide, please. Part of doing this fellowship with RNAO is setting short and long-term goals. You are welcome to go over the goals as the PowerPoint slide deck will be provided for you. But for now, I am not going to go over all of these goals at this time for the sake of time. Setting goals of this at the start of this fellowship journey was really important as it helped me to stay focused and on track. During this period of study, I ventured into a very dark place in our Canadian history. It was important to stay focused rather than staying in that dark place. By studying, listening, I experienced a small window into the First Nations culture, which has changed my whole perspective on the care I provide at the bedside. Everyone is different and has a unique journey. I now ask the question in my mind when I'm at the bedside, what would I want? And who would I want at my bedside during my last days? Next slide, please. Next slide, please. After completing the fellowship study, I was asked to present the initiatives of my fellowship. I was invited to Toronto to share my experiences from this journey, the outcomes, the initiatives that I see moving forward as a result of this fellowship. Next slide, please. The elders at Lake Helen really clarified how each and every community practices their traditions in a very different way. So you can never assume that just because a person is Indigenous, that they will practice their traditions in the same way as their neighbors just down the road. Brings us back to asking the question, what is meaningful to you? Next slide, please. Next slide, please. Okay, so as I mentioned, when I visited Pace Plat, I took the time to wait and to listen to the stories spoken by the elders. Normally for me, when I ask a question, I expect an answer. But in this case, it didn't work. This time I had to sit and wait. And when I showed the respect of waiting and being eaten alive by black flies, I received the gift of being drawn into the elders' personal stories of their experiences of people in their lives who have become ill and then died. If you could please play the video, that would be lovely.
Today,
we are aware of the technical difficulties and are working on them.
Sorry, everybody. Let's give that another try. Just a moment here. Are we seeing that now?
Yes.
Thank you so much for coming out today. My name is Judy Harvey, and I'm a registered nurse, and I'm also the hospice bed coordinator at the Nipigon Hospital. And I'm here today to ask you a few questions. And mainly it's about people who are approaching end of life and what takes place when a Ojibwe patient is approaching end of life, and what are the cultural practices when this occurs?
Everyone has their own way of going, right, to approach death. In this community and our culture, in my time on Mother Earth, I've seen many ways of people practicing how they end their death. I could speak only for my sister and my brother, but I've seen other deaths. Some of the men were getting fire, right? Preparing a fire outside her house, you know, building a sacred fire. And they were lighting it. And they were contacting certain guys from the next reserve to come and light that fire and do a ceremony for her at that. Those fires had to stay alive, burning for 4 days. I want her to travel to the spirit world. So they said, who do we get?
My name is Linda Goodchild. I'm originally from Seine River. It's very, very different from, just say, the Catholic way. For 4 nights and 4 mornings, there's somebody goes over there in the morning to make a little fire and bring a little bit of food. And then same thing in the evening time. The same thing, you just grab a little branch or something off of a tree, a little birch bark, make a little fire, and you put a little bit of food in there. That's for 4 days and 4 nights. That's to help them on their journey.
There's 2 kinds of deaths. One that you watch, a dying person. The second death is somebody that dies instantly, not knowing when it takes place. My name is Roger Nakanagas. I'm an Ojibwe, and I'm also a Christian. I go to church, and when my wife passed away of bone cancer, she suffered for 7 years. And after she died, we call it, I guess, the white man ways. We go and get the priest to do the blessing when we bury her at the graveyard.
And when my partner and I, we were both different lifestyles. Kind of, she has Catholic ways, and myself, I have native traditional ways. And some of us don't have any beliefs. Like some indigenous people here, they don't have any beliefs, and some people are traditional. Some people are Christian, and we don't all agree on the same thing. A lot of our traditions have been taken away, so we don't know what to do. Most times we are confused, and we don't have an answer. What are we going to do?
As the Indigenous spiritual care provider here at the hospital, I was actually hired because of my knowledge and background as an Indigenous person, and as a spiritual care practitioner. Because I'm a little bit younger, but I like to I don't call myself an elder yet, but I like to share what I do know. And I've been doing this for 30 years. I've become aware of over 150 different cultural practices just within the Ojibwe culture. And so being able to have that skill, and at the time of being hired here at the hospital to apply it, Indigenous culture, as we unravel it, we realize how vast it is, how big it is, and how diverse and how unique each community can be in some sense. So, so having some knowledge that different cultural practices will apply to different families based on where they come from, their communities that they're at. Some families will prefer their own elder to come, be it a family elder or a community elder, and some families will prefer just to reach out to the hospital, whatever we can offer for resources.
So we all sat down and the doctor came in and I said, we need drumming here. We need an elder here. We need smudging here for my sister. Not everyone practices this way. Some people has different other methods, other ways to do it. But us at that time, we choose to practice that way.
Some of the traditions, like I said, I believe it depends on who's the family, who their beliefs are, the clan systems. My father, I brought home because he wanted to come home. That's where he wanted to pass away. And so me being the oldest, I was the only one there most of the time with him. And it was hard because I did smudging. I'd helped him through as much as I could what he wanted, what his life was like. There was a lot going on in there for those 4 days with him.
The doctor explained to us, there's no hope of recovery for your sister, Dade Chikwa. She's just living on life machines now. So everyone's crying and everyone was releasing the healing tears, you know. And we contacted the elder, we gave her some tobacco, we contacted some drummers, and people came to that hospital.
My granddaughter was in ICU with that accident that happened. She was on her deathbed. And when the doctor told me, you better come into the room, he said something is going on with her. So my son and I and my grandson went over there. And she told us, trying to tell us something was going on. She said, they're here. I asked my girl, I said, who's here? He said, they're here. My dad's here. Or her dad passed away like 3.5 years ago. And my mom is with him. And she said, they're here too, the mother and the child. And Jesus is with them. And she said to me that I can still remember, she said, God gave permission to Jesus to come there. The monitor started to beep again. It went up. She was coming back to us. And this is what I experienced in the death of my family, my wife and my daughter. I guess what I can safely say is that we had a moment of presence of heaven being there. Heaven has no time, and we experienced that. And we moved on from there, and we were healed. And now, yes, I do feel lonely for my daughter and my wife, but the pain was taken away from us. And I don't know what God's plan is, but it is his plan. And that's the way we look at it as Ojibwe people.
We sang songs. We ate food. On the coffin, we made little birch baskets, right? And we put on traveling equipment for her journey. After she was ready to go to the graveyard, we had to have a feast. We had to have her last feast on this earth. That's what we did with my sister. So we had blueberries and strawberries handed out to all the people at Task Hall at that time, you know?
I think being open to patience and understanding of where a patient may be in their knowledge in spirituality and religion, and being able to journey with them at their level. And I think having that patience to go with them and to share with them and to show them this is how the Indigenous culture works and this is how it can be applied to your life. And to have a patient actually see them grow and see them actually heal and get better, then it's that much more exciting to see. I've actually got a success story from a woman who was a residential school survivor. So she was taught the Christian way, and she was taught that the Native traditions were evil. And she was a mental health patient for a long time, and the doctors thought she was going to be here for forever. But she came to me, and through patience and understanding and allowing her to move at her pace, and eventually watching the ceremonies that we do, sitting in on the ceremonies, and then eventually incorporating her into the ceremony and participating in the smudge and the sharing, she actually learned to appreciate the culture.
Thank you, Stephanie. If you could put the PowerPoint presentation back up. So I just wanted to chat with you a little bit about Michael Robinson, as you saw Michael in the video. Again, he's sharing from more of a clinical setting in his perspective. And if you notice, the message is very similar. Don't assume, everyone is different, show respect, be sensitive, be kind. Again, my message to you, and just a reflection of what he is saying. No perceived ideas, no assumptions. Ask the question, what is meaningful for you? Okay, so what is meaningful to you? When I'm at the bedside and I have a patient that is actively dying, I ask the question of the patient as well as the family members, what is meaningful for you in the last days? Would you be interested in a service that NDMH does provide, a healer or an elder? And if the person says, yes, I would like to have a healer come in, then my next question is, do you have a healer or an elder that you already know, someone from your community that I can notify? Next slide, please. Remember this, do not assume a person is traditional because they are Aboriginal. It is important to ask all patients if they are interested in the Indigenous traditions and cultural practices offered by an Indigenous healer. It is a service that is provided to all patients at NDMH. There are Indigenous persons who are Roman Catholic, Christian, agnostic, or atheist. Therefore, it is important again to ask the question, what is meaningful to you in your last days? Next slide, please. Kindness goes a long way. If you are at the bedside and you don't know what to say or do,
welcome
sometimes
back,
it is
day 2 of our virtual conference, What's Next in AI. I'm your
little bit of a glitch there. Steph? Hello.
Hi, sorry, Judy. YouTube was still running in the background there. I apologize.
Oh, that's okay. That's okay. Stephanie, what slide number are we on?
You are on slide 22.
Okay, thank you very much. Okay, so kindness goes a long way. It really is. Basically, sometimes it's just in the question itself. When I'm at the bedside and I ask the question of the patient or the loved one, family members that are in the room, sometimes they're taken back that I would actually ask the question, what can we do? And the big thing is what I usually say is I would like to know what I can do for you at this time to make this journey meaningful in your last days. How can I help? Because what's happening is I don't know what you believe and I don't know what your cultural practices are, but we're approaching the last stage of your life. And so let's make this right. Let's make this wonderful. And the other thing is we need to remember as care providers that we don't get a do-over. This is it. This is it. This is where you're going to shine and where you're going to provide that wonderful, sensitive cultural care. Next slide, please. So what to say and what to do? We're going to hear from Elder Betty from Regina, Saskatchewan. I read a professional paper that was produced by the University of Regina. I was just very impressed. So there was a few things that the elders stated in the paper that I would like to share with you today. Help us and listen to us as the First Nation people, as we talk from our hearts rather than our minds. And we may talk like simple, uneducated individuals, but we're not. We are very articulate, deeply spiritual, intelligent people. We talk from our heart, especially when there is a loved one lying there dying. And we want them to hear that. Care and comfort of the heart and spirit take precedence at the end of life. Next slide, please. Provide family rooms where large groups of extended family and community members can gather to pray, support each other, and send energy to the dying individual who is preparing to take the journey. Allow the traditional spiritual practices, such as burning sweetgrass and smudging, and for the appropriate preparation of the body after death. Offer cross-cultural education for healthcare professionals that will facilitate dialogue and deepens understanding between groups. Aboriginal peoples respond to care offered from the heart. When the skilled healthcare providers engage at the soul level, it is felt and appreciated. Next slide, please. Respect was a common theme as I went through this journey, this fellowship journey. It was repeated over and over again. During my time spent with the elders, Michael Robinson, Morris, the fire starter, and Kathy Loon, it was respect. Be respectful of the moment you are in with that person. Be respectful of the traditions, the patient, the family, the community members, and the spirit world. You may not, as a care provider, you may not understand the spirit world, or you may not even believe in it. But the bottom line is people in that room do. And so it's important to respect that. Next slide, please. Okay, so what slide deck am I on, Stephanie? Is this number 26?
I'm not sure, Judy. I'm just seeing the full slides right now.
Me too. Okay, I'm gonna take a jump in, okay? As part of the fellowship, I recognized that at NDMH, it was needed to identify the needs and gaps. I put together a survey to have our staff do. I included this survey into the slide deck so that you can use in your facility to identify gaps. The questions we asked and the responses we received are included. The results of the survey presented to me as a basic message from the frontline staff. Our staff want, number one, our staff want to provide good cultural, appropriate bedside care. Number two, the staff don't know the Indigenous resources that are available in our community. Number three, the staff do not know what is allowed in our hospital to provide the Indigenous cultural care. Number four, and the staff are open to having an Indigenous navigator in our facility to guide us. From the identified gaps, I then created a work plan. And so now you're going to hear from my CEO, Kathy Cavino. She is going to just enlighten us in regards to this work plan that I developed for the year 2020. Next slide, please. Actually, if you could just go through, Stephanie, all of the slides that have the survey, just keep going through, please. Okay, so Kathy Cavino, I'm just going to give her the driver's seat here. This work plan is designed to first bring awareness to the gaps and needs in our facility and step by step help our staff navigate and work towards that culturally appropriate bedside care. Please feel free to borrow and implement this work plan in your own facility. And I'm going to hand it over to Kathy.
So I think the owl will.
Oh, okay.
Will it? If I start talking? No.
Okay, I'm just going to step out for a minute. Okay.
Hi, good afternoon, everybody. So I won't go through the particulars of the work plan for 2020 for this initiative, but I think what is very important to know about the work plan is that, you know, you have to align the work with the rest of what's going on in your facility. So this work plan is strongly aligned with our strategic plan. It's aligned with our quality framework, which is based on 6 dimensions, which this meets in every single dimension. So timely, efficient, safe, PFCC, equitable, and effective care. It aligns with our patient safety plan. So you know, it can't be a standalone. It has to be something that really is driven by where you're headed as an organization. I mean, we all have so many things that we have on our plate to move the organization forward. But I think this strongly aligned with all of those areas. You know, we are a patient family-centered care organization. And this initiative, thank goodness for Judy for moving forward with that. But, you know, it has to be something that your organization is behind. Always start from the top and have your senior team have buy-in for this, because you're going to be rolling a boulder up a steep hill if you don't have that from the beginning. So I think it's just really important to say that it's good to have a work plan. It keeps you on task. It aligns. You can align it then with whether it's your education plan or what's happening in the organization to keep it moving forward. And I think we are on track to pretty much conclude everything that's on this current work plan. So we'll have to develop the next one and align it with our future goals for the organization. So that's all I had to say.
Thank you so much, Kathy. If we can move through the work plan, Stephanie, please. Okay, stop there. Okay, so the final outcome of this work plan was the development of the Last Days of Life Palliative Care Order Set for the Indigenous traditional medicines and cultural practices. To our knowledge, it is the first of its kind, certainly to our region, and if not, provincially. Next slide. Okay, so as Stephanie just goes through the slides, you have a chance to take a look at the contents of the Last Days Order Set. I won't go through everything, but just for you to just have a look over. Okay, next slide, please. Next slide, please. Okay, so I'd like to draw your attention to the final paragraph of the Last Days Order Set. Traditional wellness is central to the goal of improving mental, emotional, spiritual, and physical well-being of the First Nation patients. It is important as healthcare providers that we offer this approach as an option to Indigenous patients as well as to non-Indigenous patients. The key word is offer. This last day's order set as an option. Next slide, please. There is a cautionary piece to the last day's order set. Please keep in mind that chaga tea could cause hypoglycemia, and also the white and red willow could cause thinning of the blood. Please consult your MD prior to administering the above mentioned traditional medications. And also I'd like to add to the piece where it is not the RNs or the RPNs or the doctors that are administering these traditional medicines. It is the healer that is notified where she or he creates these medicines. And once they are, before they're administered, we talk about what's in the actual, let's say, chaga tea. We have that discussion, and then it is charted on the treatment flow sheet by the nurse attending. Next slide, please. So just to let you know, I'm really excited about the fact that we were able to roll out one of our initiatives from the work plan, and that we celebrated this year our first annual Indigenous Awareness Day. We had orange t-shirts made for the entire staff. So we had at our facility a wave of orange. And if you could see the slide here, or not the slide, but the picture of, I'm not sure if you can see it. It's our t-shirt that we had made. And then on the back, it has our Indigenous communities that surround our hospital. So we were excited about that. We also had a healer elder come to our facility and have a smudging ceremony outside at the front entrance. We also invited a drumming circle and provided beautiful Ojibwe music and drumming and singing. It was just wonderful. We also invited the Kairos blanket exercise facilitators from Lakehead University to teach our board and staff in regards to Indigenous cultural safety. Unfortunately, we had to cancel due to the COVID gathering restrictions. But our plan is in the new year that we will invite them back.
And the stories from the drumming circle.
Yes, Kathy was just making mention. Before they sang each song, they would give us a history lesson in regards to the origin of each Ojibwe song. And also some of these songs, they dated back to like 100 years ago. So it was just absolutely amazing. It was lovely. Next slide, please. There is a time to stop and listen and learn. How can you serve people you don't understand? This was stated by Kathy Loon, the Indigenous Resource Manager at the Manuin Health Center. I took part in an Indigenous cultural safety course in Sioux Lookout at the Manuin Health Center, and Kathy was the facilitator. And just to let you know that the words that she stated just basically really hit me in the fact that is my personal responsibility, not only as a person, but also a nurse, that I need to understand and I need to do some research and I need to learn about the people I'm looking after. Next slide, please. So here are a few resources to set you on your learning path. Next slide, please. Next slide, please. I am very excited to spend this time with you today. about advancing patient and family-centered care during end of life for the Indigenous persons and their families. I'm excited to share my document with you, and I'm excited about having further conversation with you. And this is my contact information. So if you'd like to reach out to me, I'd be more than happy to spend the time with you and having discussions and answering questions. My fellowship document, again, it really became a reflection of my journey. So I would like to share with you right now an excerpt from my document. And it is chapter 1. Is there anything I can do for you to help you on this journey? And I'm going to read to you a personal experience that happened to me here at Nipigon Hospital. On a cold, dark December night in 2018, as I walked down the quiet acute care hallway, I entered room 110, where an Indigenous gentleman was dying. As the primary care nurse, I examined my patient for any outward signs of pain or restlessness. I took the patient's temperature and adjusted his bedding and gently repositioned him to maximize comfort. I did everything clinically prescribed in this situation. As I turned to the patient's family and community members who were surrounding the patient's bedside, I observed how quiet and respectful they were, but also how hopeless and out of place they appeared. As I turned to the family, I asked, "Is there anything I can do for you to help you on this journey?" There was a moment of silence, and then the granddaughter asked, "Really, Judy? Anything?" "Yes," I replied, "anything. Please tell me what you need to help you in this grieving process." "Can we drum and sing our prayers?" "Yes," I replied. "Can we smudge?" I don't know how to answer that. I knew smudging was not allowed in the rooms, but I also sensed how important this was. And I had asked the question, "Hold on, let me check with our physician on call, and hopefully we can." As I quickly ran down the long dimmed hallway, I saw the physician at the nurse's desk, finalizing his charts for the day. "Hey, can you take one for the team tonight?" "Yes, sure, Judy. What do you want?" He asked, looking up. "I want the family to be able to smudge in room 110 tonight, as our patient is dying, and I know this will aid in the grieving process for the family at the bedside." He stopped what he was doing, looked at me, and then slowly stood up. "Okay," he replied. As he turned to walk down to the room and let the family know the parameters, I then contacted a local healer who came immediately. That night, the patient's room was filled with drumming, singing, and prayers. And yes, a smudging ceremony took place. As I sat at the nurse's station, listening to the quiet drumming and smelling the burn elements, I looked over at the doctor with a tear in my eye and said, "Thank you. In spite of the policy and procedure, you did what was right tonight." Just as I said this, a senior nurse came around the corner with the hospital policy in hand. She handed it to the doctor and said, "We are to follow the hospital policy." The doctor took the pieces of paper and slowly placed them in the shredder's box. As I reflect on this night, I know as a nurse, I was doing what was required to provide excellent end-of-life care from a clinical perspective. I was doing a good job. All of our caregivers were doing a good job. The senior nurse that night was doing a good job, making sure we were following proper policy and procedures. But sometimes doing a good job is not good enough. And we need to be open to how to do it best. Unintentionally, that December night, I opened the door to a better way by asking a simple question. Thank you very much for joining me today.
So there's some stuff in the chat box there.
Thank you very much, Judy, for your presentation. And yes, we did have a few things come in through the chat box while you were presenting there, and we have about 10 minutes left now for any other questions or dialogue. Dion had asked, does anyone know how I can approach my hospital to hire a knowledge keeper that is a spiritual care practitioner? Currently, we have no one. Any
Okay,
suggestions?
I'm gonna have Kathy join me. We're gonna put our masks on because we're gonna be a little bit close here. Okay, so your question again, Dion?
It was, does anyone know how I can approach my hospital to hire a knowledge keeper that is a spiritual care practitioner?
Yeah, we haven't done that here at Nipigon District Memorial Hospital, so I wonder if approaching Thunder Bay Regional or talking to your local communities. You know, oftentimes when you're endeavoring in something like this, it's good to reach out to them because they can find some finances for you to be able to provide some funding. But we haven't done that here, so I really can't speak to that.
And also, as far as a knowledge keeper, we do rely a lot on our local elder from Lake Helen, and she is a wonderful resource. I've also invited her, as well as another community member from Lake Helen, and I also invited folks from Rocky Bay as well as Pace Plat to join us on our palliative care committee. And we also created an advisory committee for the elders, the Indigenous elders that live in close to Nipigon Hospital. We've invited them to join us and to lead us and guide us and help navigate through the Indigenous cultural safety piece that we can provide at the bedside.
In all aspects of, you know, I mean, we sought them out to find out what is their vision of our future long-term care facility too in the application. So acting as an advisory going forward for us.
That's great. We had a comment that the video was beautiful and heartwarming. So thank you for sharing that with us, Judy. Sandra asks, do you have any comments on how things have been going during COVID? So they're thinking about having limits on visitors. If you can share any thoughts on that.
Yeah, so we've got both entities, as many of us do in the north. So we've got long-term care and we have acute care, and you know, we follow directives, but at the same time, we do engage our patients and family advisors in this. Certainly, we met with our resident family council in terms of visiting, because they don't give you the details. It's hard to implement these directives at some point. So we did find out from them what they felt would be the best. And so they identified, you know, the power of attorney would be the one they go to. And then from there, they would suggest a number of people. We did put a limit on that, how many people would come in with their guidance on that. So I know in our hospice room at end of life, in a non-COVID situation, we did the same thing, reached out to see, you know, what do we think would be acceptable. So I think working with your advisors and taking each scenario into consideration, looking at certainly having care partners being available. But during COVID, it's certainly been very difficult for the families that are experiencing end of life. But you know, you have to follow the directives at the same time.
We've also provided, we do have a tablet where people can have virtual visits. I know that just doesn't, it's not quite that great when it comes to an end of life situation. I do recall we had an experience where we had an Indigenous lady who was dying, and we were allowed to have, at the time, one visitor. and it was the daughter that was in the room at the time. And lucky for us, in regards to our facility, it's like a core floor. There's no basement, there's no upper floors. So we were able to open the window with this, there was a screen on, but it was in the spring. We were able to open the window, and I had a number of Indigenous family members and loved ones outside the window. So you just need to use your critical thinking, and you need to just adapt to the situation. I wheeled the bed right over to the window so that the family could see their loved one. And it was a moment that really gripped me as a care provider, and the fact that this woman did die at that moment. The family, they were incredibly grateful in the fact that we are in the light of COVID, that they were understanding and lovely in the fact that they just couldn't believe that I would go that extra mile of wheeling the bed over so that they could see their mom one last time. But yeah, this whole COVID thing, it's incredibly challenging, especially in the light of end of life. It is very, very challenging.
Definitely. Thank you for that, Judy. So we've had quite a number of thank yous coming in. Thank you for sharing your story. Very moving and telling presentation. We did have is there any other questions? Oh, does Nipigon have Indigenous death doulas? So the CBC has shared an article not that long ago about increasing training for death doulas.
No, we do not have a death doula at this time. And it is certainly something that we can look at in the for our new work plan. And to just explore, what does that look like for our facility? I love the fact that like an Indigenous death doula, that would be amazing. So that's something that we don't have at this present time, but it sounds like an amazing option.
And another comment from Kim, excellent work. So wonderful to see practical tools in providing culturally responsive care at end of life. And Dion said, Miigwech, I am an Indigenous navigator and death doula. This has been very valuable. I'm curious where Dion is.
You could shoot us your email, Dion, that'd be great.
It would be great to connect, for sure.
Thank you so much.
We're coming up 1 minute left, so I want to thank you as well. And thank you to Kathy for joining as well on behalf of CERAH for today's Lunch and Learn presentation. I am just going to quickly launch a poll, if people don't mind doing that for us just before you leave. So we'll be back in January with our next Lunch and Learn. It will be on January 20th. We'll send out information regarding that session very soon. As Judy mentioned, if you want a copy of her full fellowship documents and or a copy of the slides from today's presentation, you can certainly reach out to me and I can provide those to you. And Julia had provided her contact information as well. So I just want to say take care, everyone. We hope you have an enjoyable holiday season, despite the fact it'll probably be a lot different for many of us. But thank you again for joining and have a great afternoon.
Thank you so much, Stephanie. You're awesome.
Thank you, Judy. Sorry about the technical issue with the video.
That's okay. That's okay. That's the world we live in now.
True.
But you managed it quite well.